Hi, welcome again. This presentation will be the second presentation for pharmacology. Previously, I did a video about pharmacology classifications, how you should group them according to body system and drug classes. This time, it's gonna continue version of the previous topic. We're gonna summarize what we have learned from the previous PowerPoint and then simplify in the way that it's another way of summarize that notes and easy for you to remember. So let's get started. Firstly, you can download the template under the descriptions. This is for the purpose of private study and research. I use Kaplan, UWorld, Registered Nurse RN, NCSBN, and others. So, okay. So, firstly, I do is I write down the side effect or adverse effect, and then write down the type of drug classes and the drugs, and in what situation it will cause this condition. Let me give you an example. Do I have it? Oh, okay. Seizure. So what I do here is seizure, and then I write down what medication gonna affect it. So that you got osmotic mannitol, and then antibiotics. You got 1, 2, 3, 4. So 4 antibiotics that cause seizure. So rather than, I'm gonna go back. Lab. So rather than how we have to remember the antibiotics one by one like this is so confusing. You don't know which one causes seizure, which one doesn't. So I just summarize like this, so easy to remember. So that's how you remember. I will provide a sample template so you can work with it. Every time you did an NCLEX and pharmacology question and you trip over that question, you made an error, just add it to the notes here. Next one is, I want to talk about the liver function and the renal functions, because sometimes I getting confused. I was like, which medications that's gonna work on the processed by the liver or processed by renal, like eliminations. So so I got this one, and here these two, they work both, like they got eliminate secreted by both. Okay, now the reason why we need to know the difference is, firstly, the sign and symptoms we need to watch out that really relate to hepatotoxicity, and then the sign and symptoms or things we need to do for nephrotoxicity, because they're gonna give you a medication, let's say metformin, and then they say, what do you need to do? Like, do you need to check platelets, check following condition, or do you check BUN or creatinine? Then you need to know for metformin, is it gonna secrete in the liver, by the liver or by the renal? That's how we know it. Now, the way to do this is, let's say because renal here, the medication is less, while the liver section here secretes more. So I just remember the renal sections. I just remember all the following point. Let's say I just remember all these drugs that's gonna excrete by the renal, and then leave the liver out, because I'm like, you can't remember all of them. If you can't, then what you do is just remember one side of it. Let's say the renal side, and then the rest of the exam, if it's not pop up from the renal sections that you remember, then most likely it's gonna be the liver that's secreting that medications. Here again, orthostatic hypertensions. I write down a bit of sign and symptoms of the orthostatic hypertension, and then what we should do. For example, patient take diuretic and then complain of fatigue or disease, or in that situation, we can encourage them to lie in bed a bit longer, get up a bit slower, etc., etc. Okay. Oh, I am running everywhere. Okay, so here following sinus brachycardia, here are the following situations. For example, calcium channel blocker, it decreases heart rate as well as it decreases blood pressure. In that situation, calcium channel blocker, you want to check, make sure the heart rate is within standard range before you're even thinking of giving that. What else? Okay. Yeah, here. Bone marrow suppressions. We got following medications that cause it. They cause bone marrow suppression, leukopenia, and thrombocytopenia as well. But not all medications does like that. So following here, fentanyl cause blood marrow suppression, but it does not do the cause leukopenia. Actually, bone marrow suppression. Actually, let me just check with bone marrow suppression. I actually got confused because I assume bone marrow suppression you will have decreased white blood cell, red blood cell, and the platelet. So it should work on the leukopenia. So I'll find that out, and you can search on the internet as well. But from the reason I write like this, because when I did the NCLEX in question, I haven't encountered a question that said this medication does cause leukopenia. So you can have a search for it. Adverse events and side effect again. Here are the type of medications. Like for this one, this is the side effect, adverse effect, and then sign and symptoms of it, which should give you a red flag. If they present those symptoms, then they are experiencing adverse effect or side effects. Now, suicidal depressions, I especially pay attention to this one because it likes to pop up in the questions, and they do take priority because it's a risk. And that's all. Feel free to leave me an email or leave a comment below. And I'll see you on the last presentation for pharmacology.